Studies Session 9, Theories of Social Work Practice. Introduction. Possessing skills alone does not assure competence, for without an undergirding knowledge base, a practitioner will be little more than a technician. Epworth and Larson, 1993. Direct practice theory involves a broad and complex domain. In this study session, we will examine some theories quite relevant to direct social work practice. Learning outcomes. When you have studied this study session, you should be able to 1. Discuss social work practice theories. Social work practice theories. Practice theories vary widely in their world views, targets of intervention, specifications of techniques, methods of assessment, length of interventions, and other important dimensions. Therefore, social work practice is not based on a single theory. The proliferation of theories in the social sciences, social work, and allied disciplines has ushered in a new era that offers the potential of enabling practitioners to select specific interventions proved effective for specific problem situations. Therefore, some of the theories crucial to social work practice are: 1. Ecological systems model. According to Epworth and Larson, 1993, this model is a natural extension of the person in environment perspective. The model accords increasing importance to environmental factors and to understanding ways in which people interact with their environments. Two concepts of this model are especially relevant to social workers, and these are habitat and niche. Habitat. This refers to the place where organisms live, and in the case of human beings, it consists of physical and social settings with particular cultural context. When habitats are rich in resources required for growth and development, human beings tend to thrive. In contrast, when habitats are deficient in vital resources, physical, social, and emotional development and ongoing functioning may be adversely affected. For example, supportive social networks of friends, relatives, neighbors, work and church associates, and pets mitigate the damaging effects of painful life stressors. However, people with deficient social networks may respond to life stressors by becoming severely depressed, resorting to abuse of drugs or alcohol, engaging in violent behavior, or by coping in other dysfunctional ways. Niche. The concept of niche refers to statuses or roles occupied by members of the community. One of the tasks in the course of human maturation is to find one's niche in society, which is essential to achieving self-respect and a stable sense of identity. Being able to locate one's niche, however, presumes that opportunities congruent with human needs exist in society. This presumption may not be valid for members of the society, as equal opportunities may not exist due to race, ethnicity, poverty, age, sex, disability, and so on. Ecological systems theory posits that individuals are engaged in constant transactions with other human beings and with other systems in the environment, and this varies persons and systems reciprocally influence each other. The theory holds that people are not mere reactors to environmental forces. Rather, they act on their environment, thereby shaping the responses of other people, groups, institutions, and even the physical environment. From the ecological system perspective, it is clear that the satisfaction of human needs and mastery of developmental tasks require the availability of adequate resources in the environment and positive interaction between persons and their environment. Example, effective medical treatment given to a patient depends on availability of health facilities. Adequate health personnel, positive relationship between the patient and the caregivers, etc. A major advantage of this theory is that it is broad in scope, that typical human problems involving healthcare, family relations, inadequate income, mental health difficulties, conflicts with law enforcement agencies, unemployment, and educational difficulties and so on can be subsumed under this model. The theory is relevant and useful to social work practice in that it gives the practitioner an opportunity to assess the resources of problems, determining the focus of his or her intervention and what to be done. 2. Systematic eclectic approach. This is a vigorous approach to practice. Bertler, 1983. Bertler and Clarkin, 1990, which helps in making judicious choices and implementing chosen interventions skillfully. A systematic eclectic practitioner adheres exclusively to no single theory. Rather, he or she selects models and theories that best match a given problem situation and accords highest priority to techniques that have been empirically demonstrated to be effective and efficient. Systematic eclecticism is thus most demanding, requiring the practitioner to keep abreast of emerging theories and research findings. However, general criteria exist which guide the social workers in deciding which theories and intervention to study in depth. These criteria are: 1. The extent to which a given theory has been supported by empirical research. 2. If two interventions have both been proven effective, the intervention that produces results with the least expenditure of time, money, and effort is the more efficient and is preferable to the other. 3. The extent to which intervention and techniques subsumed under the theory are specifically delineated. And 4. Ethical implications and the practitioner's level of knowledge and skills with respect to given interventions. Behavioral theories and other models of practice. These theories and models include Otto Ranke's theory, the task-centered system, cognitive therapy, behavior modification, client-centered, therapy, ego psychology, role theory, learning theories, classical operant social learning, decision theory, crisis intervention, humanistic theory, existential theory, solution-oriented therapy, and several models of family therapy. Study session summary. In this study session, we noted that to analyze problems, persons, and situations, to plan remedial interventions, and to implement appropriate techniques require an adequate grasp of practice theory and knowledge about human behaviors in the social environment. Social work practice requires more than one theory for effective interventions with clients or individuals in need of help. Some of these theories useful for successful practice with individual or groups having psychosocial problems include ecological systems theory, systematic eclectic approach, behavioral, humanistic, existential theories, and other models. End of SO 303. Thank you for listening.